use the chat. We go. So feel free to hop into the chat and say hi, introduce yourselves, let people know what your name is, where you're dialing in from. It's always wonderful to see the connections that emerge from some of these sessions. And in a couple of minutes, I'm going to introduce a Mentimeter so that we can get a sense of who's in the room, where are you at on your impact journey, and what, if any, resources would you like to share? We thought this could be a good opportunity to kind of crowdsource some resources. Welcome those of you who are just joining. I'm Julia. I'm going to be chairing today. I'm part of the HALN team and we're just getting started, so settle in. So the topic we're going to be looking at today is impact measurement. How do we measure the impact of anchor organizations and the impact they have in their local communities? It's a topic that comes up all the time in the learning sets that we run in the Health Anchors Learning Network. And in the time that we've been running the network, the progress in this area has been really significant. So 6 years ago, when we started running the network, there was very little in the way of active impact measurement. There weren't really any national impact measurement guidelines or toolkits, and we now have a couple of really brilliant resources, one of which we're going to be hearing, two of which actually we're going to be hearing about today. So it feels like there's a lot more resource that you can draw on as an anchor organization. And as often when people come into our learning networks and our events, one of their first questions is, how do we measure the impact of our work as an anchor? How do we tell the story of this work? And we know often that there's already a lot of work happening. So there's a kind of initial period often of trying to gather and map the existing work that's happening before moving into developing a more coherent system for reporting on impact data, and often thinking about how that data is presented at board meetings or decision-making forums in the organizations that you're working within, so that it has oversight at kind of exec and board level. So I'm really excited today that we're going to be hearing one example of how this is happening in practice from an organization, and also an example of a new dashboard from outside of health. And we always think in the anchor world that it's helpful to have examples from outside of health. We have for many years known and drawn inspiration from anchor work going on in higher education, lots of work going on in the housing sector, lots of work going on in the arts and cultural sector. And in all of those sectors, there's stories, examples, resources, and evidence that we can draw on that are just as relevant for our work as health anchors and anchors in local authorities, and increasingly anchors in the private sector who are joining in alongside some of the public sector anchors. I'll say one thing on language before we move into using our first kind of tool and getting a bit of a sense of who's in the room. The language around anchor organizations can be a little bit elastic. So I just wanted to say how I'm using the term and give people a chance to share examples in the chat if they're using it in a slightly different way. At Innovation Unit, we use the term anchor organization to describe the really significant place-based institutions that often are delivering services, but have those services often mean that they have a really significant economic footprint and potential economic impact. So we're talking about local authorities, housing associations, hospitals, NHS trusts, large museums, large employers and private sector organizations. And just by virtue of getting up and turning the lights on in the morning and making decisions about where they buy their stationery, where they get their energy from, who they're partnering with, how they're running their estate, they can have a huge and really significant economic impact, and can use that impact to really tackle health inequalities and the determinants of health. So that is the kind of framing that we use when we talk about anchor organizations and the role that they play. Welcome those of you just joining. I think we're going to let's dive into the Mentimeter, and then we're just going to go straight in and hear about some wonderful examples of practice. And if you've just joined us, feel free to head over and say hi in the chat and introduce yourself. So let's share. Sarah, I wonder if you could quickly share the HALN, the Mentimeter slide so people can get in, and I will head into the back of it and make it live, so present it. So we've got a few questions for you. If you've not used Mentimeter before, the idea is that you can either scan that QR code or go to www.menti.com and enter the number there, 2204-4065. And once I can see that quite a few of you are on there, I'll start sharing my screen so you can see the results, there's 3 questions we want to ask you. The first question, which you'll see as you're landing into the Mentimeter, is about where you're at on your impact measurement journey. So the question is, where are you at on your impact measurement journey? It's a scale of 1 to 10. 1 is, I've not even started yet. I'm coming here today to find out what I could be doing and what my options might be. Number 10 would be, we're doing loads of impact measurement. We've got a system in place. We're reporting on our impact as an anchor and are ready to share our learning with you. And so it's going to give us an average around the room. I can see that almost 35 of you, heading up to 40 of you are in there and responding. So I'm just going to, Sarah, encourage you to keep that slide up for 1 more minute so people can join. And then I'll share my slide so we can see where the numbers are landing. So if you've just joined, please scan that QR code or head into Mentimeter and add the 8 numbers on the left. And we're going to invite you to share a little bit about where are you at on your impact measurement journey as an anchor in terms of measuring your anchor activity. And that is the focus of all of our conversations today. Sarah, I think you could stop sharing there. We've got about 69 people, 70 people in there. And what I'll do now is share my screen. Oh, my computer is suffering in this heat. It's being very slow. Here we go. So the average 3.4. So interesting to notice. Many of you maybe are at the very beginning of your journey. So you're in the right place. We've got lots of resources that we'll be sharing with you at the end of the session. You're going to hear from some brilliant speakers who will hopefully give you an overview of their journey, some of their starting points and the tools that they're using. And you might hear some interesting conversations and see some interesting links and resources as we go through. So 3.4 was the average. The next question I wanted to ask you is this one here. It is, for those of you who are on your journey and measuring your anchor work, what tools or resources have you found helpful? So let us know if there's a blog or a toolkit or a person you're following on LinkedIn or Twitter that you found really helpful in terms of giving you ideas, support, inspiration. Oh, amazing. Straight in there. So add in anything you think you found helpful that others might found helpful as well. And we will share the download of this Mentimeter afterwards so you can have a look at them. Interesting to see UCL Partners, the toolkit up there. That is what we're going to hear a little bit about today and has been, I think, one of the biggest changes in the sector in terms of the support around measuring anchor work, and it's incredibly useful. The HALN website, thank you, whoever said that. We do have a ton of resources on impact measurement, and there's lots that you could be seeing in there. We've got Economic Intelligence Unit. I'm guessing you might be from within a local authority or a regional body. Really exciting to hear that. And I think that's definitely a good shout, getting help from them. The HALN website is a couple of examples from Scotland there. Another shout out for the UCL toolkit, also the Public Health Scotland Progression Framework. Lovely to have some examples from Scotland here. And they are, I'm based in England, but Scotland, I think, has significantly further on than England in terms of the policy framework and the strategies that the health boards have produced there. So it's well worth having a look if you're not based in Scotland at what's been going on there. JRF report on anchor partnerships in Leeds. And there's a really wonderful Leeds self-assessment framework as an anchor that's very helpful. Public Health Scotland Progression Framework again. Fab. Okay. People might still be writing. In a moment, I'm going to move us on to the next and final question on Mentimeter. So if there's anything else you wanted to share, just pop it in the chat and we'll add it onto the resources that we're sharing at the end of today. The final question I was going to ask you to reflect on, which will help me and our speakers tailor what we're sharing with you today, is what questions would you love us to explore today? What are the questions that brought you into today's session? What would you really love us to talk about, to think about, to respond to in the dialogue that we've got over the next 50 minutes or so? So take a minute. What is the question you'd love us to explore in today's session, and then add it in there? And then we're going to move into hearing from our first speaker. Great. Social value, measuring social value, integrating data from different sources. Where to start? Yeah, absolutely. What are those starting points? Top tips on impact measurement, another one for social value. Measuring things that are harder to measure, the woolly stuff, examples of good practice. How to measure our social value. Yeah. Measuring the culture and the impact of that. Yeah. Hints and tips, where to begin. Yeah, key areas you'd recommend measuring, what's worked, making it meaningful, deciding between qual and quant data collection. Fab, interesting. How to measure the harder things. There's a few here about how do we measure the things that aren't so easy to measure. Maybe we don't have existing data sources, or the things that are quote unquote woolly. Different data sources that you've drawn on, connections with the 10-year plan. Great. Keep it coming. This is really useful for our speakers to see. I'm sure they'll be thinking already whether there's things that they might pull out a little bit more, and we've got plenty of time for Q&A too. How to quantify some of the qual feedback. Great. Context of 10-year plan, emerging place models and ACOs. What lens are you viewing your organization through as an anchor? And just so you know, I mean, we've got a lot of health representation here today. Not everyone is from health, so watch out for acronyms, and I'm sharing this with our speakers as much as anything. So if you what is an ACO, what is PHS, just spell it out for us as we're going through today, because not everyone will be immersed in our own worlds. Measuring the long-term impact of engaging with younger people, education and employment, another one on social value. Keeping focus and not trying to measure everything. Okay, fab. This is really, really helpful. I am going to stop sharing my screen there. It's going to stay open, so you can keep adding in, but we are mainly going to use the chat for Q&A after each speaker. So just bear in mind. Don't worry, Anna. I knew what you meant. I just knew that not everyone did. So ACO, Accountable Care Organization. Thank you. So yeah, use the chat as we're going through the presentations. If someone's presenting and you have a question or a reflection, just add it in as we go along. I'll also give you a bit of time at the end to come in. And I'm really excited to share the speakers with you today. It's so first off, we're going to be coming to Liesl and Rachel, who are in Suffolk and North East Essex Integrated Care System. Rachel, I know, has been part of some of our learning sets. We've been following the work of Suffolk and North East Essex for a while. They've got some really exciting work happening, and they're going to be talking about their approach to measuring their work. So Liesel's coming from a research, information and evidence perspective, and Rachel is the communities lead. So I'm going to hand over, we're going to spotlight you, Liesl and Rachel. You've got kind of 10 to 15 minutes, 15 max, and I'll give you a little 2-minute warning if you're up against it, and then we'll go into some Q&A. So over to you. Excited to hear a little bit more about the work you've been doing.
Great. Thanks so much, Julian. Thanks so much for inviting us to come here. Myself and Liesl are going to give you a run through, a very quick whistle-stop tour in 10 minutes of what we've been doing in SNE, which has been running for several years. But so as a starting point, just to set the scene for where we are in Suffolk and North East Essex. So you can move slides, please. These slides will be shared. So all I'm going to say to you is the key things about Suffolk and North East Essex. We have rural areas, we have urban areas, we have coastal communities, we have areas with high deprivation, particularly areas such as Tendring in North East Essex. And what we'll be able to see from some of the later reports is about how actually working as anchors and collaboratively really helps address some of those inequalities that exist. Thank you. Next slide. So in terms of our anchors movement, so we can sort of track it right back to 2019, much before the time where I joined that ICP, and obviously based upon the Health Foundation report. So from 2019 to 2025, where we are now, where we have our first set of anchors impact reports, you can see we've done a lot there to build the foundations. And I think that's a really important part before we start measuring impact. It's really about building on the right foundations. So around having an anchors charter, having a programme board, which has actually been revisited twice, drawing upon good practice such as UCL partners work, and really importantly, working with our providers to see what's most important to them. Next slide, please. So in terms of that sort of working with our partners, what we decided when we kind of did a revisit a couple of years ago around how we progress anchors, we spoke to our NHS providers who we were aware were very much mindful about anchors. We're doing some work around anchors, but perhaps wanted to think about how they could work more collaboratively to share learning. The things which we heard from them, unsurprisingly, they're really stretched. Resource and capacity was a real challenge here. And so being able to think about the ways that we could build in measurement, building working collaboratively, whilst linking in with things such as estates committees and workforce committees was really important. Also things about how do we provide tangible examples to be able to really promote what anchors means to a much wider workforce rather than just the few people working in that space. Next slide, please. So in terms of building on those foundations, this is sort of our governance structure. We're really fortunate that within Suffolk and North East Essex, we have a chairs board. So the chairs of all of our ICS organisations really took this on board from our local authorities, from our providers, and that's very much where our anchors and workers reported into. Equally, we then set up the programme board. It's quite a small number of people who come regularly. That's our NHS providers there. I saw that Anna's on the call here from EPAT, and she's been great in moving it forward from EPAT's perspective. But what we decided is what we needed is that really senior executive level, director level sort of commitment from our providers. And then what we would do is think about how we link this in with existing organisations and committees. So, for example, if we're looking at estates, we would take it to the estates committee, sustainability, procurement, those kind of things. So whilst we have that top exec level helping to lead their anchors work within their organisations, it was then saying, well, how do we then build this in and move the pieces of work forward specifically with the experts in that area? And then just to that sort of third column, just around wider partners, we didn't, the work with Suffolk County Council and Essex County Council, they're key partners, as are our unitary and councils as well. They haven't at this point taken part of the active measurement of dashboards, but they're very much part of how we feed in and report things, and that they are sort of on board and looking at how they would be able to adopt it further. And we also report into our ICP committee and ICB board. It's a really quick summary. It's much more important for you to hear from Liesl, who's the brains behind the dashboard. So over to Liesl.
Thanks, Rachel. So I did notice earlier on that a couple of people were really interested in sort of how this began. So I'd been involved with the Anchors board from kind of 2021-ish, and I was given the challenge of trying to come up with a dashboard or a scorecard or something like that, so we could begin to then show how we're making progress. So one of the principles that we use within our system is that when we do anything like this, we try and start with why. And having been on the receiving end of requests for data and sort of feeding into dashboards and such like, I think this is really quite an important thing for people to understand why we're doing this in the first place. So we did set that out for the partner organisations, recognising you've signed up to this wonderful Anchors Charter. These are all the things that we've committed to. But actually what we're really here to do is to focus on delivering outcomes for people. And this is the way that we in NHS organisations particularly can make a contribution to the wider determinants of health and tackle inequalities through that direction, and not just thinking about healthcare inequalities, but thinking about health inequalities. We also want to be able to measure our own progress and to learn from each other and make sure that we were doing the right things well. So it's then being able to sort of think about how we can work collaboratively to bring about good outcomes for our community, and how each organisation's collective efforts make a contribution to the overall change, because none of us can do it on our own. So next slide. I think it's really important to talk about, in terms of our dashboard, what it is and what it isn't. So the whole point in doing this, the whole point in collecting any of this data and trying to measure our progress, is that it should be a catalyst for conversation and action. Sitting where Rachel and I do within a sort of a bureaucratic system, really, we aren't the ones that are actually making a difference. That's happening with the bigger anchor institutions themselves, within the sort of the providers, the hospitals, the community trusts. They're the people that have got the power to take action. So we wanted to be able to focus on the outcomes for people. and what are the benefits that would feed those outcomes, and how could we enable each other to help achieve them. It was also going to be a way of sharing ideas and being able to support that collaboration. And it helps us to develop a system-wide approach to social value and to workforce development as well, sort of being able to share the opportunities to do things together. It was a really good way to see that if we're moving in the right direction, are we showing change? Are we making an improvement in some of these outcomes? But more importantly, as I said, this is a catalyst for conversation and action. So it would provide a tool for each organisation to be able to take to their board to discuss this at a really senior level, because that's where the accountability for taking action happens. So it should also be developmental, it should be iterative. Our population is dynamic, so our dashboard ought to be too. We need to be responding to what's happening in our population. Most importantly, I think, is what it isn't. It's not a performance management tool. It's not something that we want to say, no, this organisation gets the gold star for doing really well, this one's on the naughty step. That's not how we want to use it. It's not a competitive thing, and it's not a static thing, because as we get sort of more sophisticated in how we're able to do this, we may change some of the things that we're measuring, or we may look at it and think, actually, this isn't working. So what should we be doing instead? In our system, we'd already got a really well-established outcome-based approach. And this is the other reason that it was quite a useful thing for me to do, because I've been involved in presenting and developing this. So next slide. What I did initially was to move the work that we were doing in Anchors into the logic model that feeds our outcome-based approach. So essentially the big outcome that we're aiming to achieve for all of the whole population in our patch is for them to stay well and feel well. So from an Anchors perspective, and what the evidence says, my background's in public health, by the way, so this is part of the reason that I'm also thinking in that way, is that there are a number of ambitions that can help contribute toward that. So we know that things like, having a job, living in a good, buoyant economy, being able to live in an area where the air is clean, it's environmentally sustainable, being able to make the best use of our land and assets as public sector organisations, and then working together and being able to support our communities and having a civic responsibility approach, are all things that collectively put together would help to drive that outcome. So the approach that the logic model takes is to kind of unpick this step by step. So just taking the first ambition there, and this one is thinking about our role as employers, as anchor institutions. So the ambition would be that local people have stable, fulfilling jobs that pay them at least a living wage and offer them opportunities to learn, grow and progress. That seems like a reasonable ambition. I think if you asked any of the organisations or any member of our population, the public, they would say, yeah, they're good things to have. So these ambitions are things that we hope would collectively galvanise people into thinking this is something that we do want to achieve. And then you can start unpicking sort of, well, what are the benefits that would contribute to achieving that ambition? We put those into the form of I statements. So things like, if I have access to local employment and access to training, development and progression, that's going to contribute toward that ambition. Having stable employment in an organisation that's good to work for, that would be a benefit. And collectively, those benefits then help to achieve the ambition. So our role as anchor institutions then is to think about, well, how do we enable those? And this is where we can look at the evidence base. So we know from the evidence that things like rework programs, volunteering, internships, work placements, pre-work programs that are aimed at or targeted to our local population in perhaps more deprived areas, or people that have fewer opportunities to gain employment, could be helpful to enable those benefits. So it's just taking it back through that logic model, and then the individual delivery programs and the work that's happening within the various anchor institutions themselves. That's the that's the what. That's what people are doing to contribute to those enablers that follows it back through that logic model of enabling the benefits. Next slide.
Just a couple of minutes left as well, Liesl.
Right, I shall crack on a bit swifter. I was also involved in developing the UCL Partners toolkit. So actually that was really useful, because that way we could pick up on what were some of the measures that we should be including in that, and things that were based on what people are already doing. So next slide. And then in terms of data collection, it simply puts that logic model into a template. And one of the things that you'll see that features quite large on this is that it focuses a lot on qualitative measures. And that's because when we trialled this approach with East Suffolk and North East Essex Foundation Trust, it was recognised from their experience that actually the qualitative stuff, the stories, support this far better. So that's just an example of what the data collection template looks like. Next slide. That's a bit more of what it would look like. So you can see we've got those prompts there to help people fill that in. Next slide. And the next. But this is the kind of thing we got back. So actually it was a huge richness of information, and we didn't want to lose that. So next slide. What we then did was to present this data back in a dashboard at various different levels. So it's a summary level that just has on a page, if you've only got 2 minutes, you need a brief overview of our Anchors programme. This is what it looks like. These are all the ambitions for each of the pillars. And this is just a few headlines. Next page. If you've got 10 minutes and you want to understand a bit more about what's actually happening on a particular Anchors work stream, then you've got something that's a bit more in depth that delves into each of those I statements and the contributors. Next slide. So that's just a bit of the rationale about why we've got these different levels. Next slide. And I think I'm back over to Rachel at this stage to talk through.
Thank you. We'll be super quick. If you want to move to the next slide, in terms of all of that content, so overall, the dashboards were completed in 3 goes. We had one which was around workforce, then we joined estates and sustainability up, and then we did procurement and community. So over the course of 12 months, basically every 4 months, the providers were asked to complete these dashboards, and then they would send them all back to us, and that's where we would collate them. And what we were aware of, that bit around sharing the learning and having those tangible examples to sort of share more widely.
Created a tool that individual organizations within your partnership can each fill in, and then you do the job of kind of weaving it together and creating those impact reports. I'm sure people will have specific questions, and at this point I want to encourage everyone just to have a think and add in any specific questions or reflections that you want to in the chat. And I wondered, just as people are doing that, there were some interesting questions in the Mentimeter which might be relevant. So there were quite a few questions on whether you're measuring social value or not. And I wonder if you want to say a word or two on how that has come into your conversations about measurement, if it's something you're trying to measure, and if so, how. And then I can see there will be a few other questions coming up soon, but should we start with that one?
Do you want to go first?
No, you go first, Rachel. Go on.
So in terms of measuring social value, because the other part of my role is working with the voluntary sector, so this is something that comes up a lot, and obviously colleagues will be familiar with the different tools that are there. I think what is fair to say is from the dashboards which we've produced, we're very much focused on the qualitative and the sharing, the learning. I think there's ongoing conversations about how you measure social value and actually what we're measuring it for. I think when I spoke to lots of people who have spent even more time than me working in this area, they often say the point, are we just counting beans for the beans' sake kind of thing? So I think that's why at this point in time, we've gone very much down the qualitative. And what was interesting, I recall a meeting where actually we was meeting with some finance colleagues, and it was a director of finance. He said, I really like the qualitative here. And we thought, well, do you know what? If a director of finance is saying that, then we're feeling okay with that. But Liesl, do you want to add any more?
That was really the point that I was going to make, is having trialled that with a very large acute provider, they found from their board level discussions, it was the qualitative stuff that was making a difference. And they started to see much more value in that, because that was the thing that it's these stories that start to speak to people's hearts as well as their minds, I think. And that was the thing that was making a difference to their actions.
And it's interesting because a lot of people in the Mentimeter also asked questions about how do you capture the qualitative impact and how do you measure the woolly things, or measuring through qual and quant. Is the data that you're getting back, or the feedback that you're getting back, primarily qualitative then? Is there any quantitative that you're bringing in?
There is quantitative as well. It's all of the measures that are in there. We pulled from the UCL Partners Toolkit, because they were things that having contributed to that, they were things people were collecting already predominantly. So again, we work with this through with some of the organisations that are our anchors, because we didn't want to start with something that was difficult for them. Let's start with getting the basics right. Let's start with the things that are easiest to collect, and you'll see in the toolkit that they're sort of rag rated in terms of how easy. So we began with the low-hanging fruit. Horrible term, but that is essentially what we did, with a view to actually, if we can get everybody starting to focus on this and seeing perhaps that it's not as onerous as it would initially appear, then we can begin to build on that gradually and start introducing new measures, as I said, iterative process.
And there's a question in the chat around whether you've attempted to measure the economic return of some of your anchor work. I wonder if that's come up in conversations at all.
I don't think we have, to be honest, but then I'm not sure that we would necessarily want to try and do that specifically for anchors, because it's so incredibly complex, and I don't think it necessarily hit the reasons for us doing this. The reason for us doing it was to make a difference to health inequalities and outcomes for people. Yeah. Great point. And yeah, fair enough. Rachel, is there anything else you want to add before I bring in our next speaker?
No, it's just to say that, as Liesl said, this is very much iterative. I mean, from our perspective, being able to, after 12 months, have 5 organisations, large anchors, all measuring, we were like, this is brilliant. There's far more to move on with. And I think that's a bit, again, where it needs to be led by each of the providers. And just because I know Anna is on the call, I remember, for example, around their estates and sustainability, they applied, because each organisation, measures and records reports on their own activity. And they talked a lot about sustainability and around some of the environmental impact and savings which they've had through different types of reusing schemes and various bits like that. But I think, we're not saying we're perfect. There's definitely more we can do, but I think as a starting point, we're definitely, and there, Anna's got her hand up. She's on screen.
Anne, do you want to come in?
Thanks. Yeah, I just thought it's helpful to contribute from a provider perspective in the SNE space. We have the great privilege in EPA, I use that term in a slightly sarcastic fashion, to work with 3 or even 4 ICBs, depending on what day of the week it is and which service you're talking about. And I'm able, therefore, to compare the approach to anchor measurement and oversight, I don't know if that's the right word to use, across various different ICBs. And what I've really appreciated is that Rachel and Liesl have done loads of work to, I think, lead the anchor discussion across Greater Essex and influence the other ICB, so Mid and South Essex ICB and Herts and West Essex ICB, to the SNE way of doing things, I think. And although the same methodology hasn't strictly been embedded in the other 2, SNE I definitely see as a leader in this space. And the thing I've particularly appreciated as a provider is the point, I just want to underline the point that both Liesl and Rachel made earlier in the presentation, which is this wasn't ever about marking people's homework. This wasn't about monitoring and performance management. It was only ever positioned as information sharing and scaling and learning from good practice. There was never anything punitive that came with not being able to answer that bit of the template in exactly the same level of detail. There's a very strong acceptance that not every anchor does anchor work in the same way across the different pillars. And I've really appreciated that flexibility from SNE team.
That's lovely to hear. Thank you, Anna. Really helpful to have that perspective and just to see how you can create an impact measurement dashboard or approach that feels helpful rather than punitive, that gathers information and starts to bring it together in what look like some amazing impact reports. I can see a few other brilliant comments in the chat, but I need to move us on to our next speaker. So thank you. Those of you who are adding in, keep going. And there's a few different links being shared there, lots of thoughts. I want to welcome our next speaker. Let me just share my slide briefly. So Andira, if you want to come on screen as well in a moment, we will spotlight you. My computer's being so slow. Here we go. So welcome Andira, who's joining us from the Young Foundation, where she is working on the Civic Impact Dashboard. So a dashboard on kind of citizen civic impact from a different space. So we think there'll be lots of learning and kind of fresh thinking in this that'll be really relevant for anchors of different sectors, different sizes and scales. And Andira is going to give us a bit of an overview of the work she's been doing, coming really from a design perspective, I think, which I'm really excited about. So Andira, over to you. Do you want to say hi and then take it away, and I'll let you know when you've got a couple of minutes left.
Brilliant. Thanks, Julia. All right. So, hi, everyone. My name's Adira, and I work as a senior researcher at the Young Foundation. I'm going to be talking through the process of developing the Civic Impact Dashboard. And I'm going to start sharing my screen now. I will do my best to give you the headline kind of approach that we took. And I'm looking forward to the questions that you'll have after the presentation. So give me a moment, please. Okay, cool. So this project is part of the NCIA program, which stands for the National Civic Impact Accelerator. I am one of 3 team members that's worked on this. I have a background in design research, visual communication, and participatory methods. My colleague Al comes from that approach of looking at university impact and strategic partnerships. And this project essentially centers around this main question of how can universities be better neighbors? And that's what we mean when we talk about civic impact and place-based relationships in this particular context. In terms of aspects that we've covered across this project, we've looked at civic activities, which are a set of collaborative and inclusive relationships and practices that work towards the benefit of a place or towards a shared set of outcomes. We've included civic mission, which is the choice of universities to recognize the value and potential of these relationships and practices and invest in them to agreed outcomes. Civic engagement, which is the process of building and continuously improving locally beneficial relationships, as well as civic impact, which is the main focus, the outcomes that flow from such relationships. And these are broad terms that can be really difficult to kind of grasp when it comes to how you can assess your university's impact in terms of quant evidence or qual evidence. And what we're really trying to do is look at these different domains through a lens of place-based activities and see where we get to from there. So the NCIA program is funded by Research England, and it is a 3-year piece of work that looks at gathering evidence and intelligence on impactful civic engagement. And it's developed through a partnership between Sheffield Hallam, NCCPE, City Ready, QMUL, OECD, and the ICS of the Young Foundation. And again, so it's a massive project. It's a consortium of many different partners who come with different areas of expertise about higher education institutions, about civic impact in the education space, and how we can start drawing connections between universities, the way they exist, that goes beyond just economic value. The purpose of this particular dashboard is to help universities maximize the impact of their civic strategies and activities to ultimately be able to improve the lives of people in their communities of place. And in terms of the audience that we have worked with, and they have formed a core part of our user testing group as well. They include universities and other anchor institutions, policymakers that are focused on the role of anchor institutions, and higher education staff members. My role in this project is focused on user-centered design and trying to understand what is it that people who work in this sector need in order to have better accessibility to evidence about place-based data in correlation with their university and where it stands. And the way that we structured this project looked at having a series of user-centered design workshops with a user testing group in order to understand what their pain points were, what their goals were based on their different roles, as well as areas that we could explore by providing them information in the form of a dashboard. So our starting point was the Civic Impact Framework, which looked at mapping, partnering, agreeing, resourcing, evaluating, and learning across different domains of what it means to be a good neighbor in a place-based context. And we split these into aspects of social, environment, well-being, cultural, economic, facilities, and leadership. And what we have attempted to do is expand on each of these different domains. Again, a heads up that the dashboard is a work in progress. It currently only focuses on the cultural aspect of what it means to explore that understanding of being a good civic neighbor. So the pains and potential gains of working with civic data that we discovered through these workshops were there is difficulty in finding reliable local data and a limited understanding of how to interpret existing data sets. People want a broader definition of civic index measures. They want to include things that go beyond economic impact, that touch upon other aspects of social life, which are not currently being recognized. There is a difficulty about integrating and easily working with mixed data types. So such as civic agreements require certain aspects of evaluation and impact in terms of both quant and qual that can be really challenging to put together. And there is a desire to avoid the pitfalls of further benchmarking across universities because that creates comparison and competition, and it really doesn't help in looking at the whole system through the lens of collaboration. And we need to prioritize inclusive design and accessibility to cater for those who have limited digital and technical skills and ensure that the information design caters to this audience to make sure that the data is not skewed when it is visually represented. Key learnings from our user testing group included the importance of accommodating a multidisciplinary approach to using data, which is not just to quantify impact, but to make sure that civic work with communities was valued and is valuable by using storytelling that looked at combining narrative and numerical data. It was really important to have the right scope. And it's very difficult to try and solve all of these different challenges with just one digital product, which would then result in a lack of focus and poor design. So the NCIA collaboration has sought to map the user journey and needs of the wider program's intended outputs. And then we've tried to fill those in with each partner institution coming in with their area of expertise. We have also found that accessibility questions get overshadowed by technical questions around data and evaluation, and it's been really challenging to maintain that balance. But we are currently in the stage of gaining feedback from wider audiences in terms of the way the dashboard exists, how it works, and where we can start to bridge that gap. So this is the prototype of the Civic Impact Dashboard. It is currently a data visualization tool, which will support HEI staff to understand and explore the civic contribution of their university to their local area and communities. It focuses only on the cultural impact, and we aim to expand this to cover all other domains of civic impact. We are, as I said, in the process of gaining feedback, and I'm happy to share the link to the dashboard so that everyone can test it out even after this workshop. And please do get in touch with me if you feel like you have anything to contribute in terms of the data, or even just you're interested in having a conversation about the work. And I'm going to just stop sharing my screen for a quick second so that I can pull up the actual dashboard and take a couple of minutes to take everyone through that. So it's currently hosted on Tableau, and it draws on HESA data, which is publicly available data to help university staff explore their civic impact. It is interactive and it is a prototype, so it does take time to get to different pages as it loads the data. But what you essentially do is you start by selecting your geography. And I'm hoping it doesn't crash on me. Okay, there we go. You are then able to select your university. So I'm going to go with Imperial. Brilliant. And now you can see that's been highlighted on the map. And after that, you can select your local area. So Imperial is located in Kensington and Chelsea. And that is what I am going to click on here. And now you can see on this map below that the local area has been added along with the university. And then you go on select benchmarks. And there are different variables that you can control here. You can choose your university group to see which cluster you want to address, which one you want to get more data on. And then once you fill in your variables, you can move on to exploring civic impact. Currently, only cultural. And once you select that, it's able to draw on HESA data to give you information about this particular domain. So it includes information from the Active Lives survey. You can choose domains here that look at museum education, public lectures, performance arts, exhibitions, and so on. And this gives you that information in this format. Currently, we are redesigning it, but the intention is, I think, for us to hold close that this dashboard is not something that is a tool that gives you the analysis. It's not something that will give you that impact. It's a way to get to it. So it requires that evaluation and analysis to be done on the user side. And I think something that we are fighting against is there is no one way to be able to get that information. I would love if it was possible to get that impact understanding by just clicking a button, but the best that we can do is ensure that the way we have approached this in terms of our user-centered process, in terms of gaining feedback, is as true to real life and to real world challenges that users face, and then give them the information they need in order to make decisions that are strategic, that are influenced by policy and place-based information. And I'm going to stop sharing my screen. And
almost bang on time. Was there anything else you wanted to just briefly say before we go into some questions, Andira?
No, I think that's everything from my side. I hope that was helpful. It's useful for me to talk through this as well because the project is currently in progress, and it's useful to understand areas of difference and areas of continuous work. But yeah, I'm happy to share the link as well, in terms of just being able to test the dashboard for everyone.
Thank you, Adira. And I'm thinking, you know, I'm really curious. So areas of culture isn't something I've seen anchors in the local authority or health space measuring before. But so I think that's like an interesting challenge to anchors in other sectors. There's something I think I'll be really curious as the dashboard evolves. There's some really common pillars around economy and environment and well-being, which I think anchors in other sectors probably are using. And I think it'd be fascinating to see what kind of measures and data are being brought into that. Do you know what the timescale is for the evolution of the dashboard?
Yeah, so we're currently working towards CivicOn, which is in October, and that's a conference where we will convene as that wider consortium along with other partners, as well as participants who are interested in learning more about civic impact and place-based relationships. So we have, I think, about 3 or 4 months just to get moving towards that next iteration. And yeah, again, welcome insight and feedback about data sources or ways of evaluation, because I completely agree with you. It's really hard to measure certain aspects of soft power as well, or like place-based work that go beyond numbers. And currently we're exploring the possibility of combining the dashboard with case studies about how people have approached certain projects that cater to these aspects. So they have the ability to compare or contrast ways they can apply that quant data in their own work.
And I think that kind of speaks to some of the questions that you've probably spotted in the chat that are around storytelling, qualitative, like how can we weave in qualitative narrative sources of data, and to what extent do you think the dashboard will be able to pick up on those in the future?
I think something that we're trying to explore is the simultaneous production of what we're calling the Place Data Playbook. And that is essentially a how-to guide that looks at providing a blueprint almost for commonly faced challenges that people in evaluation or impact have when it comes to understanding place-based work. And that can be used as a supportive toolkit along with the dashboard. And we're trying to understand what's most useful. So we build a certain amount and then we go back and we have a user testing group and then we change what we have done and what needs to be done. But currently it's working between either the Place Data Playbook or looking at case studies and how they can be combined with quant data.
Okay, that sounds great. And what I'm thinking is that many of the people on this call will have a local university, and that university partner, well, maybe a partner, maybe a potential partner, maybe using or tapped into the dashboard. And it could be interesting as part of your conversations on impact measurement to explore what other tools your partners, though particularly I've seen in housing and higher education, there are sometimes some existing tools or ways of measuring Anchor and Civic Impact, which could be really helpful. Adira, thank you so much for joining us. We're going to move into our kind of final closing stages now. But if you are happy, we will definitely share some of the links that you've shared today and include it in our kind of post-event wrap-up. There's some also really wonderful contributions being shared in the chat, a couple of different evaluation toolkits, more stuff on anchors. We will take all of those and include them in a post-event email along with some of the HALN resources. And that was really what I wanted to just share with you now as we move into our closing moments. We've got a couple of resources that we'll share with you today. There's a Driven by Data 2-pager, which is on kind of good principles for measurement as anchors that we produced a couple of years ago, and a UCL Partners resource who you've heard referenced a lot today as the organization that created a measurement toolkit for health anchors, which is incredibly helpful. So for all of you who are at the start of your measurement journey, that toolkit looks at the common measurement areas that most anchors would be considering, where there is national, regional, local data for those. And it really does, it's like a kind of really incredible guide to help get you started. So can't recommend that enough. Please, please, please do go and have a look. And if you enjoyed today and you would like to connect with other people working on anchor work, community wealth building work, we have regular events that we call Anchor Exchange. Those are lunchtime peer learning spaces. They're really informal. They're kind of drop-in lunch and learn spaces, which we facilitate. And you get to meet a bunch of really interesting people working on anchor stuff across the United Kingdom, and often go away with some ideas and inspiration. And the next one of those is on the 16th of September, 1 till 2 p.m. So we'll also share the link to sign up for that.